All right, hello everybody, and thank you for joining today's annual call for Promoting Interoperability Measures and Improvement Activities webinar. During today's webinar, the Center for Medicare and Medicaid Services will provide an overview of the activities process for the Promoting Interoperability and Improvement Activities performance categories, which began on February 1st, 2021. And after the webinar, CMS will take as many questions as time allows. So now I will turn it over to Vidya Salatin, the health insurance specialist at CMS, to begin.
Thank you so much, and thanks to all of you for joining us today to talk about the 2021 MIPS annual call for promoting interoperability measures and improvement activities. Next slide, please. Next slide, please. This is a quick reminder that today's presentation is just a tool. It's just a general summary of the program and the call for measures, but it is not a legal document. So for the official Medicare program provisions, I recommend that you visit the relevant laws, regulations, and rulings for reference, as policy frequently changes, and that is the source of truth. Next slide, please. So today we're going to go over a very brief overview of the merit-based incentive payment system, which we call MIPS. We're going to talk about the 2021 call for promoting interoperability measures. We're going to talk about the 2021 call for improvement activities, and then we're going to have a slide that provides some available resources, some links that would be helpful to you. Next slide. So today's webinar will only focus on the annual call for measures and activities process to submit promoting interoperability measures and improvement activities for future MIPS performance period. The presentation will not provide an overview of the promoting interoperability or improvement activities performance categories for 2021, nor will we be able to answer any questions about how to participate in MIPS. If you want more information about the actual participation in the promoting interoperability performance category and the improvement activities category, we direct you to the links on our website, the quick start guide for promoting interoperability and improvement activities. Next slide, please. So first, we're going to go over a brief overview of the merit-based incentive payment system, or MIPS. Next slide, please. So the Quality Payment Program came about after the Medicare Access and CHIP Reauthorization Act of 2015, or MACRA, ended the Sustainable Growth Rate formula. So the Quality Payment Program was designed. It is divided up into two tracks. One track is the Merit-Based Incentive Payment System, which we call MIPS, and the other is Advanced APMs, or Advanced Alternative Payment Models. Today, we are going to talk about MIPS and the call for measures and activities in the MIPS program. Next slide, please. So MIPS is divided up into 4 performance categories. Each hold a certain weight toward the final MIPS score. Excuse me. The quality performance category is worth 40% of your MIPS score. The cost performance category is worth 20%. The improvement activities is worth 15% of your MIPS score, and promoting interoperability is worth 25% of your MIPS final score. The MIPS final score is compared to the MIPS performance threshold to determine if you receive a positive, negative, or neutral payment adjustment. One note about these percentages: in 2022, the quality and cost performance category weights will change to 30% each. Next slide, please. So the annual call for promoting interoperability measures and improvement activities provides an opportunity for clinicians, associations, medical societies, and stakeholders, to include beneficiaries, to identify and submit measures for consideration for the following categories. EHR measures for the Promoting Interoperability performance category, activities for the Improvement Activities performance category, as well as measures for the Quality performance category. And obviously, we're focusing this presentation on promoting interoperability and improvement activities. We're not going to go into detail about the call for quality measures in MIPS. The annual call for measures and activities is part of CMS's commitment to involve stakeholders in the focus and evolution of measures and activities in the program. Next slide, please. So the recommended list of new measures and activities is publicly available for comment for a set period of time. CMS evaluates all comments received during the rulemaking process. The final Promoting Interoperability measures and improvement activities that are selected will be posted on the Quality Payment Program Resource Library. Measures and activities are different for each MIPS performance category, and so we have a different process for submission for each of the performance categories. Next slide, please. So first, we're going to talk about the call for Promoting Interoperability performance category measures. Next slide, please. So as I mentioned before, the Promoting Interoperability performance category is worth 25% of the MIPS final score in 2021. And the focus of this performance category is to promote patient engagement and electronic exchange of information using certified EHR technology. Currently, we require that providers use a 2015 edition certified EHR technology. The performance category contains 4 objectives with measures within each: the e-prescribing objective, health information exchange, provider to patient exchange, and public health and clinical data exchange. And some changes that we have made to the performance category measures for the 2021 performance period. We've retained the Query of Prescription Drug Monitoring Program, or PDMP measure, as an option. However, we've bumped up the number of bonus points to 10 bonus points. We've renamed the support electronic referral loops by receiving and reconciling health information, and changed the word reconciling to incorporating. We've added a new measure that's optional, the health information exchange bidirectional exchange measure, as an alternative to reporting the other 2 measures in the health information exchange objective. And we've updated CERT requirements in response to ONC's 21st Century Cures Act final rule. Next slide, please. So what are we looking for? So we're interested in adding promoting interoperability measures that build on advanced use of CERT using 2015 edition certification standards and criteria. We are looking for measures that promote interoperability and exchange and incorporate the use of FHIR, or fast healthcare interoperability resources, and APIs, or application programming interfaces. We want to add measures that improve program efficiency, effectiveness, and flexibility. We'd like to promote patient access to their health information. Obviously, we want to reduce clinician and administrative burden. We have we have 4 different performance categories, but we'd really like to make sure that we align these measures with the efforts that we have in the improvement activities performance category and the quality performance category. So we'd really like to align measures that we developed in promoting interoperability with improvement activities as well as quality measures. In addition, we do promoting interoperability in the hospital section in the inpatient area. And so in the Medicare Promoting Interoperability program for eligible hospitals and critical access hospitals, we'd really like to make sure that we align promoting interoperability measures and goals and objectives with that program as well. Next slide, please. So when we're accepting submissions, what we're looking for in the submission form are ideally health IT measures that are performance-based versus attestation-based. So measures that are calculated using a numerator-denominator versus yes-no. We are very interested in developing measures that help address the opioid use disorder, opioid use. So any opioid use disorder measures related to prevention and treatment are very important to us. Measures should highlight beneficiary health outcomes, facilitate improvement in patient care practices, reduce reporting burden, or include an emerging certified health information technology functionality or capability. We do not intend to duplicate existing objectives or measures. We would like measures that are measurable and can be implemented, measures that can be validated, and then ideally measures that could be applicable to all MIPS eligible clinician types. Next slide, please. So submission opened on February 1st. The email address to submit your call for measures submission form is listed here, MIPS_PI_call_for_measures_submission@cms.hhs.gov. Please keep in mind that this email address is different than the email address where you would submit for call for improvement activities. The form must include a measure description, a measure numerator and numerator description, measure denominator and denominator description, if it's a numerator denominator measure, any applicable measure exclusions, and then any cert functionalities that will need to be used. CMS will review measures and evaluate them for applicability and feasibility. The deadline for submitting EHR measures for the Promoting Interoperability performance category is July 1st, 2021 for 2023 measures for the 2023 performance year. Next slide, please. So the next few slides are just screenshots of the actual call for Promoting Interoperability performance category measure submission form. Again, the email address is listed here. Next slide, please. We would like you to fill in all of the stakeholder information. Obviously, the information listed under considerations when proposing measures are the same items that I mentioned in previous slides, so I won't go over those again. But these are kind of the things that you should keep in mind as you're creating or coming up with or identifying or proposing measures. Next slide, please. So the required information for measure proposals. One thing that's new about this year's submission form is that in addition to a space to describe the measure and provide program relevance, we asked a few more pointed questions to really hone in on some of the priorities we have in the MIPS program for promoting interoperability. So for instance, we ask if the measure builds on, how the measure builds on the advanced use of certified EHR technology, how the measure promotes interoperability and health information exchange, does the measure support the efforts of opioid prevention and treatment, and how does the measure align with improvement activities or quality performance categories. We want you to fill in each of these spaces. If there is nothing to include, please specify NA or not applicable, but including the information will really help us understand the purpose of the measure and how it can really change or can really benefit clinicians as they report and participate in the program. Next slide, please. Then section 3 contains specifics about the measure. So for instance, if it's a numerator denominator measure, we ask that you provide the specific language to describe the numerator and the denominator. If it's a yes/no statement that needs to be attested to, being very specific about what the clinician needs to attest to in order to meet the measure. We have a space for you to include exclusion criteria, and we've also included an area for any rationale that we should consider as we look at this measure that you haven't already provided in previous fields. We also have a section that talks about functionality. So if there are certain functionalities that need to be used or need to be created in order to perform this proposed measure, please include that here. Next slide, please. And now I'm going to turn it over to Jacqueline Rappaport to continue the presentation. Thank you.
Thank you, Vidya. Next slide, please. Okay, great. So hi, my name is Jacqueline Rappaport. I'm part of the Improvement Activities team supporting CMS. And so first I'm going to give you a quick overview of the Improvement Activities performance category, and then we'll talk more about the call for improvement activities. So in contrast to promoting interoperability and quality measures, improvement activities are a test only. So you respond yes or no that you've attested to participate in improvement activities that improve clinical practice. The improvement activities portion of MIPS is worth 15% of the final score in 2021, and you must earn a total of 40 points to receive the full score. So there are a few ways you can get to those 40 points, either 4 medium weight activities worth 10 points, 2 activities worth 20 points, high weighted activities, or a combination thereof. And there are certain exceptions for example, for small, rural, or underserved practices to that score maximum. So currently there are 105 activities in the improvement activities inventory across 8 subcategories, and those are listed here. Next slide, please. So here I'll review just a few policy changes for the 2021 performance period related to improvement activities. So we had 2 improvement activities that were modified in their description, and we removed an improvement activity because it was obsolete. And so that's reflected in that new 105 number. In 2020, we also added a COVID-19 clinical data reporting improvement activity, which is still in effect. Though note there was a modification to its description in an interim final rule with comment published in September. And there are a few changes related to criteria for proposing new activities, which we'll discuss further in the coming slides. So first, criteria related to public health emergencies was included so that improvement activities related to public health emergencies can be proposed all year, though the improvement activity would be incorporated in the next rulemaking cycle after it was proposed, if it was accepted. We also included a pathway for the Department of Health and Human Services to propose new improvement activities directly. And we included a new criterion that improvement activities can be linked to existing quality measures and cost measures. Similar to a criteria that Vidya just outlined, we want to see linkages across the categories as much as possible. Next slide, please. So let's talk about the process for proposing new or modified improvement activities. So first, please note that proposing a new improvement activity for consideration to be included in the quality payment program is completely voluntary and not a requirement for participation in MIPS. So just a moment ago, we saw the list of 8 subcategories. Here they are again. So new activity proposals would designate one of these subcategories for their proposal to fall into. And a few other notes about proposing a new activity. So similar to the call for promoting interoperability measures, we have a call for improvement activities form, which we will also review in a moment. Importantly, if you are proposing a new activity, we want you to ensure that improvement activities are distinct from quality measures. So the way it's structured, although we're interested in linkages across the topics in activities to measures, the activities themselves are not structured as measures. So activities are clinical actions, not measures with a numerator and denominator. And they do not generate a score or rate. They just are not structured that way. So if you want to review what an improvement activity looks like, you can look at the performance period 2021 improvement activity list on the QPP site, and there's a link on this slide. And that's in the resource library section. Next slide, please. So here are a list of criteria that will be considered when reviewing new improvement activity proposals. So a new activity must meet at least one of these criteria to be accepted into the improvement activities inventory. And I do just want to point out that the new criteria I mentioned a moment ago, including activities that can be linked to existing and related to existing quality and cost measures is there on the right in the middle. So that's a new criteria for this year. Next slide, please. Okay, so again, the submission period is now open for new improvement activities. It was open on February 1st and runs until July 1st, same as for promoting interoperability. So activities proposed for inclusion should be sent to the improvement activities team using the submission form, which again we'll show in a moment and is on the QPP site. And it should be sent to this email address. So CMS call4activities@aptassoc.com. So again, this is not the same email address as was shown a moment ago. This is a different team processing it before the decisions are made. And again, all of this information is on the QPP site. And so we do also just want to note that all communication regarding improvement activities proposals, including follow-up questions for submitters, will come from this email address I just read. And again, the timeline here is that any proposals for new improvement activities submitted by July 1st, 2021 will be considered for inclusion in the 2023 Quality Payment Program performance year, beginning January 1st, 2023. So if we receive a proposal after that date, it'll be considered for future performance periods. Next slide, please. So here's the form. Again, we touched on kind of the main pieces. Here we just are asking for some background information and an proposed activity title and an activity description. Of course, the more specific you can be in what the activity would entail, that is helpful. Next slide, please. So 2 categories we're showing here on the form. The first is to designate the proposed subcategory. Again, I mentioned that a few minutes ago. There are 8 subcategories relevant here, so you would designate which one your proposed new activity would fit into. And then we ask for supporting documentation here. So this is where you would provide evidence, background, literature, any data showing how or why the proposed activity could improve clinical practice. So linking to literature, the more you can give here, that will help us judge the relevance of this improvement activity. Next slide, please. So here, just want to distinguish that here, documentation to use as proof of activity completion. So this would be what a clinician or group could use to support attestation of their improvement activity. So this is information that could be requested of a submitter in the event of an audit. So it does not need to be submitted with the improvement activity, but here the submitter would just describe, here is something that might show that this improvement activity was completed. And then on the bottom, level of effort, this just helps us determine the activity weight based on the effort that would be required to complete the improvement activity. Next slide, please. So here I just want to distinguish that what we've been talking about up until now related to proposing new improvement activities. And here we do also accept in our form if there are any proposed modifications to existing improvement activities, in which case you'd fill in this portion of the form and you'd include which IA you would propose to modify. Please include the full name, which has that subcategory abbreviation and number, and then the modification proposed, in what domain you'd like to propose a change, and a rationale for why you believe the modification is warranted. Next slide, please. All right, thank you very much, and I'll pass it back to the team to talk about available resources.
Hi, this is Vidya again. Just wanted to point out some resources that are available. Out on qpp.gov, we have a 2021 Call for Measures and Activities Toolkit, and it is a zip file with several pieces of information to include the overview fact sheet for Call for Measures and Activities, as well as the submission forms for promoting interoperability and improvement activities. If you've got any general questions about the Quality Payment Program or MIPS, the email address is qpp@cms.hhs.gov, or you can call 1-866-288-8292. If you've got specific questions about the submission process, the email addresses for each of the performance categories, improvement activities and promoting interoperability measures submission, are included below. And with that, I will turn it back over for the Q&A. Thank you.
Great, thank you, Vidya. All right, so we will start the Q&A session of this webinar now. If you'd like to ask a question, you may do so by submitting your question via the chat box to be read out loud, or you can raise that green hand icon on your go-to menu and we can unmute your line if you'd like to ask the question verbally. So we can give it a few minutes for questions to come in. Again, please feel free to raise your hand. And in the meantime, I know we received a few questions about downloading the slides. So please note that the slide deck recording and a transcript of today's session will be posted to the QPP webinar in the next 1 to 2 weeks. And we will send out that link via the chat box as well. Right. Again, we'll give it a few minutes for questions to come in. As a reminder, today's webinar is focusing on the annual call for measures and activities process for both the promoting interoperability and improvement activities performance category. So we will focus questions and answers related to that topic. Okay, we have one question related to resources on the QPP resource library. So specifically, can you please confirm if the 2021 improvement activity submission form has been posted on QPP and if it is the same as the 2020 version?
Hi, it is not the same application submission form as for 2020, but 2021 is posted out there in the Call for Measures and Activities Toolkit. If you have trouble accessing it, feel free to contact us and we will get it to you. Thank you.
Great, thank you. Okay, your next question asks, if they submit measures for consideration, how soon would they hear back on adoption of those measures?
Hi, this is Vidya. For promoting interoperability, they'll get a notification that we've received their measure submission. Most probably the measure consideration will happen during the rulemaking process. So once measures for the 2023 performance year are proposed, that information will be included at that time.
And it's the same for improvement activities. So anyone submitting an improvement activity, you'll get a notice that we've received it by the end of the call period. So short on or shortly after July 1st. And again, the improvement activity, if proposed, would be included in the rule in the subsequent year. So you would be hearing from us about the fate, I guess, of your proposal about a year later, so in 2022.
Great, thank you. Right, regarding the Promoting Interoperability submission form, how does the measure build on the advanced use of CERT? And can you please provide some examples to explain?
This is video. I'm not sure if I understand the question. So we are definitely asking that as you propose measures, that you include measures that promote the advanced use of certified EHR technology, either highlighting certain CERT functionality, promoting exchange, using some of the updated mechanisms such as FHIR and APIs. That's what we're looking for, and I'm not sure if that's answered the question.
Great, thank you. Yes, if that did not fully answer your question, please feel free to re-clarify through the chat box, and we can get that addressed. All right, next, if questions were submitted in 2020 and not, or sorry, if measures were submitted in 2020 and not adopted, would they be carried over, or should stakeholders resubmit?
Stakeholders should, to be on the safe side, resubmit. It's very possible that if it was submitted in 2020, the CMS policymakers are still considering any submissions, but it's in your best interest to resubmit, even providing more detail if possible.
Okay, great, thank you. All right, again, if you'd like to ask a question over the phone line, just please feel free to toggle the hand icon and we can unmute your line. Otherwise, regarding improvement activities, can you please clarify what you mean by having improvement activities align with quality measures and how stakeholders can get quality measures to align with an improvement activity?
So I guess I can start here. So just that there are linkages between the concepts. So again, the structure of an improvement activity is not the same as a measure, but if there's a concept in the quality measures inventory, and there are over 250 QM, so there are a lot of concepts. If there's a concept in there where there is an improvement activity that isn't the exact same thing, but something that relates to that concept, we are interested in seeing the linkage that there's a concept of importance, linking the two. Yeah, I'm not sure if others on the team want to add anything to that.
I agree with that explanation. One of the areas that we mention a lot is opioid use prevention and treatment. So any measures that could focus on that, but at the same time, any improvement activities that can focus on that, those kinds of things, when we get measures and improvement activities that cover some of the same areas, they sort of complement each other, and that's sort of what we're looking for as we develop the MIPS program.
Great, thank you for that. Okay, we can give it a few more minutes for questions to come in on the annual call for measures and activities. Again, please note that today's webinar is focusing on the annual call for promoting interoperability measures and improvement activities. So again, please, we will be focusing our questions on that topic. Okay, one more question on promoting interoperability. It reads, with the overlap of ADT feeds, would an ADT feed bonus measure for reconciling ADT information be applicable for PI, or something around direct addresses being uploaded on the NPPES?
I'm not sure I have an answer for that. So, Ketchum, if you could jot that question down, we can get an answer outside of this call. Thank you.
Sure, thank you. All right, next question. Is use of telehealth services that expand practice access for all providers, and is it only for under the public health emergency? What is expected for the activity to be eligible for an improvement activity, and would providing telehealth under the public health emergency qualify?
I don't think that's something we can answer on this call. We're just talking about the process for submitting improvement activities. So if you have a specific question about a concept, feel free to email the improvement activities email that was listed in the slides or the help desk, and we can redirect that question and answer it more fully.
Great, thank you. Okay, and just a reminder, we'll go back to the resources slide, seeing a few questions about where to access these resources. So everything is available on the QPP resource library, which we will send out via the chat box. But please note that most of this information you can access via the 2021 Call for Measures and Activities Toolkit, which provides an overview fact sheet and as well as the 2 submission forms. So we'll go ahead and send that link out via the chat box, and you'll see that soon. Otherwise, it looks like that's all the questions that we have for today. So again, in regards to this webinar, we will post the presentation, the slide deck, as well as the recording and the transcript of today's session to the QPP webinar library in the next 1 to 2 weeks. And that link was just sent out through the chat box. Otherwise, thank you all for joining us today. And that concludes today's webinar. So you may now disconnect. Thank you.